Welcome to StaffBuffalo's Pain Points Podcast. Hi, welcome to another episode of the Pain Points Podcast. I'm Lauren Lewis, and today I'm joined by Allison Raffaele, who's the CEO of Medical Health Associates of Western New York. Allison, thank you so much for joining us today.
Thank you for having me.
Really excited to have you on the Pain Points Podcast. I know we've gotten to know each other over the years professionally, and as you've been CEO of Medical Health Associates, I've noticed a presence you've posted on LinkedIn about chronicles of a CEO and doing posts about your journey in your career and what got you to your job today. So I'd love for you to start by telling your story of your career and what got you to your CEO position at this organization.
So my career path has been very interesting. It's not a typical career path. I started out at community college, which I think for me was such a wonderful experience. I thought I wanted to go into nursing, realized that maybe that wasn't exactly what I wanted to do. Ended up getting a degree in surgical technology, worked in the OR in Boston, Massachusetts for a little bit, and very quickly learned that I didn't want to be on the clinical side of healthcare, but I love the healthcare field.
Yeah.
So luckily I was afforded the opportunity to work in different areas within the hospital. I was a unit secretary for a bit. I worked in a surgical center. I was a business analyst. So I really got to learn all the interworkings of how a hospital runs.
Yeah.
And I spent about 7 years doing that. And then my husband's job transferred us to Western New York in 2009, which wasn't something that we thought we would be, someplace we thought we'd be living, but
neither of you are from Western New York?
Neither of us are from Western New York.
I love that. So, you're probably like, what are we doing moving to Buffalo?
And that was the joke, except now, 16 years later, we can't imagine living anywhere else.
God,
So this is home.
Yeah, that's great.
And then when we moved here, I was just finishing grad school and started working at one of the big hospital systems, then went to the other big hospital system and worked outpatient primary care for quite a few years. From there, I went to an outpatient private OB/GYN practice that was a wonderful experience. That I feel like was such a great experience in my career. We did so much. It was a lot of provider recruitment. It was a lot of really aligning expenses and revenue. We built a new building.
Oh, wow.
Moved the building. So that was super exciting.
That's a lot of logistics to manage too.
It was a lot of logistics. It was something I feel like I really had a lot of professional growth at that time.
Cool.
That was great. There came a point though where I thought, I'm not sure there's any growth here because I was a practice administrator and that was the top. I was never going to go back to become a doctor.
Right.
So I would never be a doctor. And I started to think, well, maybe I want to teach. Cool. So I actually taught at a local college. I did an evening course of anatomy and physiology and basic medical terminology. And I did not enjoy that. Teaching is not my strength.
Why is that?
It was, I think there was a curriculum, a very structured curriculum that I had to follow.
Yeah.
And it was teaching by the book. And I've taken grad students as interns for, many years.
Yeah.
I've always been one to mentor people, but the actual college classroom wasn't really for me.
Okay.
It could be that point in my life and career, it wasn't right. Who knows, maybe 15 years down the line it will be. But that was an interesting experience because I practice administrator by day, college professor by night.
It's a lot of work.
It was interesting.
I'm sure it was very exhausting too.
It was exhausting. And then COVID was starting. And I decided it was time to make a complete career change. And I ended up applying for a position at an animal hospital, a 24-hour animal hospital.
Oh, wow.
And I was the hospital administrator there for about 3 years. Always been a lifelong animal lover, volunteer, foster parent, all of that. But I found very quickly that trying to take your hobby and make it your profession is emotionally draining.
I bet, yeah.
The hospital experience, though, was so similar to a human hospital in that we had an MRI, we had surgery, we had neurosurgery, chemotherapy, all things that you would have in a normal hospital.
Right.
We had an emergency room, all of those things. So
you forget sometimes as, whether you're a pet owner or not, that pets require all the same medical care as humans do. They have a lot of the same development and anatomy. Yeah.
Yeah. And then during my time there, I actually connected with an old colleague that I had served on a board with, and he reached out and said, this other colleague that we know is retiring and they're having trouble filling his position. So lo and behold, we were having breakfast. It was a day in December, and he, that afternoon, put me in touch with my now predecessor of this position, and I interviewed the next week with him and the HR director. Then I met the board a few weeks later, and then I did a presentation. It was about, I call it the longest interview ever. It was a Friday, and I did a presentation for the board and any other partners that wanted to be in attendance. I'll never forget, the presentation started at 7:30 in the morning and went till about 8:30, and then after that I visited all 8 locations.
Oh wow.
So I finished the interview at about 4 o'clock.
That's a
It
long
was
day.
a snowy, Buffalo, windy day. It was freezing, and of course I was dressed for an interview, so not inappropriate footwear or anything like that. And then I accepted the position.
That's awesome.
And,
you must have felt just exhausted and drained, relieved, because I'm sure you were anxious,
Yes.
leading up to that day and preparing your presentation, and then interviews like that, you're on all day.
All day.
And
There's no break.
There's no break. You're putting your best foot forward,
Mm-hmm.
and those days like that are completely draining. I've done stuff like that in my previous career, and it's like you're just mentally drained, physically drained, and you just need to veg out for a little bit.
Yes, and I think that's exactly what I did that entire weekend.
Yeah, good.
But it felt like it was going to be a really good fit. And
good.
From the presentation to meeting everyone at the offices, I was just like, I really hope they make me an offer.
Yeah.
And then what was really great was I was able to give my prior employer a lot of notice because my predecessor, Chris, was retiring.
Right.
So he,
That worked
thankfully,
out nicely.
he was kind enough to extend his retirement date so that we had about a 2-week overlap. Which
Nice.
is great. So I got to work with him, kind of see the ins and outs of what he does. A lot of did a lot of the reporting and those kinds of things, and he did soft handoffs to our, IT vendor, our social media marketing people, all of those. So everyone kind of knew that he was retiring and here was the new person. So it really made it for a successful transition.
It's so nice when you're able to have a good transition like that, especially if you felt that instant connection to the organization and the people. It makes it that much better. It's going to be a good fit. You're excited, and I'm sure it was hard to leave your previous position, but at least you were able to leave them in a good spot too by giving enough notice as well.
Yeah.
So it's always wonderful when you have a good transition. Tell me about the pain points that you've had to overcome taking on the role as CEO. I'm sure Chris did an amazing job, right? And had a lot of things in place, but when you bring in someone new with a fresh perspective, I'm sure there's some things you can find, some gaps and opportunities to help the practice and the organization grow, develop, and take to the next level. So what were some of those pain points that maybe you identified that helped you kind of tackle some new ideas and solutions for medical health associates?
Sure. So I would say from the get-go, I knew I had very big shoes to fill. Because Chris was he was the first employee for Medical Health Associates when they were formed in 2017. So I knew very big shoes to fill. Knowing Chris, as I have professionally for so many years, I knew he was very well loved and so I was a little apprehensive. The Friday he left and we all waved goodbye. And I remember standing in the front of the corporate office with my staff, and they all kind of looked at me, and I was like, all right, it's just us now.
They're like, now what?
Now what? But there's been some different things that have come up. I would say communication is definitely one of the bigger things with this many offices, and each office functions very, very independently, and we want to keep it that way. So really learning the ins and outs of basically staying in my lane, making sure that, okay, this is the culture of that office. They've done it that way well before Medical Health Associates was formed, making sure that I am able to still follow that while ensuring that they're following compliance regulations and insurance regulations. And some of those things I would say have definitely been a challenge of pointing out some things that people don't always like to hear. It has been a bit of a challenge, but I think that if you explain the why to people, why you're asking them to do something or why that practice isn't feasible, people are usually pretty receptive.
Right.
The other piece has been any changes that we've implemented with our leadership team, especially. We always tell them that if it doesn't work, we'll go back to the old way, or this is why we're doing it, or what is your opinion? I think
So
one
important.
of the challenges too is actually getting opinions, which people love to tell you about themselves and this and that, but
Yep.
sometimes getting that real feedback of this is not going to work, or this is what I think would work better, this is my idea, isn't always easy to get out of people.
I think sometimes people are afraid to give their opinion. They don't want to be wrong. They don't want something they say to be taken the wrong way. But really, you were just looking for feedback. And I think for your transitions, especially leadership transitions, I've always seen the most successful ones are organizations where there is communication, there is transparency, and you're not just coming in to make changes right away without communicating the why behind it. And so building that rapport with all the different employees to make them feel comfortable with sharing feedback and opinions and thoughts or questions really helps. Then you can get a lot more information to help make the organization better as a whole.
And I think too that having, coming in as a new leader, of course, everybody is new to me. I'm new to them. So as awkward as it is for me, it's also awkward for them because here they have this new CEO that's coming in when they've known Chris forever.
Yeah.
And I'm different than Chris was. So there's definitely been some challenges with that, but it goes back to communication, knowing what the expectations are and being clear on those is huge.
Absolutely. If they're doing change and there's no change management, and you're just really not, people aren't understanding the why behind things, it's just not going to be successful transition. Tell us, you mentioned medical health associates and several offices. Each office has kind of their own personality, their own culture sometimes. What is medical health associates? Like, what makes up medical health associates and what are the practices?
So that's a great question. So back in 2017, 3 private practices came together. They didn't want to join a big group. They wanted to still have their autonomy, but be able to have some support on the administrative tasks so that they could be doctors and not have to worry about compliance and credentialing and billing. So they came together and said, we're under one tax ID number. So all of our billing, all of our contracts are centralized. And so from a corporate level, we handle human resources, which payroll, recruiting, all of those things that go along with human resources. We have an accounting office, we have a director of finance, we have a quality department, which of course in pediatrics, quality is huge for making sure quality gaps are closed and roster management, making sure that our patients have the correct primary care doctor or pediatrician listed with their insurance company. That's a very big piece. We have a central billing office here, which is actually something that I implemented not too long ago, actually. It was just April of this year. We previously had a hybrid model where we outsourced the majority of our billing and did a little in-house, but now we do it all in-house.
That's awesome.
And we found that that's been very successul.
Oh, it's great.
That was definitely a risk and a big jump, but it
Sounds
was
like a big project.
It was a big project, and it was I realized after a little bit of analysis that we could do it better ourselves. Our prior billing company was great, but doing it ourselves, we have direct oversight day to day of what everybody's doing. We're finding that claims are going out faster, we're getting paid faster, so that's been fantastic.
That's awesome.
And also everything compliance comes through the corporate office as well. So as Medical Health Associates has grown, it started out with just Williamsville Pediatrics, Tonawanda Pediatrics, Transit Meadow Pediatrics, Island Pediatrics. And then if memory serves me right, it was Suburban Pediatrics and Alden Pediatrics that came on next.
Okay.
And then from there, it was Western New York Pediatrics, which that's our South Towns group in Orchard Park. And then Maine Pediatrics was the very last group.
Awesome.
So we have our smallest group, which is about 18 total employees and providers. up to our largest group, which is upwards of about 45, 50.
Oh, wow.
So we really have a
Nice range of practice
it's a
sizes.
very big range, and everyone is different, which is great. It makes it, no two offices are the same, which I think is really important because you can't have two offices function the same, even if you're it's just not, we can't have.
No.
People are different, policies
People
are different,
exactly.
patients are different, so.
And the patients too, they find the practice that they more resonate with and
Yes.
more in line with them, or where they feel comfortable, especially when they're bringing their children into a doctor's office.
Yep.
They want to make sure that they feel comfort and that they're getting the best care for their patient, for their child, the doctor's patient. But it can vary, person to person, family to family, and what is most important to them in the care that they expect that their family receives.
And one of the big things too that makes us different is that we don't share doctors across locations. There's always one exception, but that's actually about to stop at the end of the year. But otherwise, if you're a doctor at Western New York Peds, you are just at Western New York Peds.
Yeah.
So there's not that back and forth or sharing of staff. So it really allows our patients to feel like it's still a private practice because we really are still a private practice. We don't have that. No one's looking over everyone's shoulders to say you have to do it this way.
And it just doesn't have that corporate feel. And we've seen that shift in healthcare. I know in Western New York specifically, and I'm sure across the country, where a lot of private practices have felt the push to join big groups and big corporations to help with the administrative burden, to help with cost as they have to transition to, have had to transition to EMR systems and new technologies to support what they do in healthcare. And I know that was a requirement probably the early 2010s, right? Where medical practices had to shift to being online and being on EMR. And it forced the hands of a lot of private practices to do that and join big groups. And I've seen shifts in offices where they used to be really a nice, personalized feel, and then they get so much more corporate. But then you almost see like a shift back at some point too, where some of them are leaving the bigger groups and joining like more smaller groups. So I think it's great that medical health associates form so that each practice can still maintain its own identity, but have the shared services.
Exactly. And that's really what we strive for, because we don't want that big group corporate feel. We want that intimate kind of feeling, not only for our patients, but for our staff. We hear a lot during the recruiting process of staff that have come from big groups and they feel like a number, and we really don't want people to feel like a number. And we're a really unique model. There's actually only one other model in the country right now that is modeled like us.
Really?
Yep. We were modeled after a group also in New York that recently changed their model. So at one point we were one of three, and now we're one of two.
One of two.
So it's a really cool model. It works really well for us.
Yeah.
It was definitely a risk when these doctors came together and said, let's see if we can make this happen. But the cost savings of being in a big group is significant, and that's something I've always been really passionate about, is cost savings and efficiencies, and are we getting the best deal?
And it's important. I mean, the cost of healthcare is increasing constantly, and what you pay for health insurance, and that's going up. It's getting crazy. So I'm like, how can we make sure that patients are still getting the best care, but it's also not breaking the bank for people or for businesses, meaning the healthcare practices and their employees too, and the physicians. And I also think it's important too, when you look at healthcare, physicians are doctors. They went to school to practice medicine. Medicine, at one point was an art. And I felt like a lot of times that art of practicing medicine has been taken away, because they are forced, a lot of physicians are forced to write a certain prescription and treat a certain way or get a certain test, because that's what the insurances will cover. And it's hard.
It's very hard. It's definitely, just in the little over 20 years I've been in healthcare, the shift has been absolutely huge.
And a lot.
And it seems like it changes every month, every day. It's, every week it's something different that comes up, and now we can't do this and we have to do this, and our reimbursement's being cut, but guess what? You now need to do more. So it's that doing more with less, which is a very big challenge.
Oh, I bet it's that constant battle of how do we still provide great quality patient care, but also run the business.
Yes.
Too. And I think, that's why it's great to have a group like Medical Health Associates where the doctors can still focus on seeing the patients, and there's a core group that's running the business.
Well, we're running the administrative kinds of things, but the each office has a nurse manager and an office manager, so the day-to-day is still very much run by them.
Okay.
But when you look at the larger corporate oversight, the compliance plans, the security risk analysis, all of those things that you need in a company, instead of each office having to have their own, we're able to manage that at the corporate level so that they can run their day-to-day.
From day to day.
Yes.
Exactly.
Which really keeps them still private versus, some of the big mega groups where it's, we tell you how you're going to run your day-to-day. Where my offices, they decide on their hours, their schedules, all of that is completely on them.
Oh, that's good. So they still have their own, they still have autonomy.
Yes. Yes.
That's great. Now, since you assumed the role of CEO at Medical Health Associates, when I mentioned it earlier, you have kind of been tasked, we chatted before, with kind of helping to improve the marketing of Medical Health Associates as well. And one of the things you're doing is your Chronicles of a CEO post on LinkedIn, which I love, and I always read them. So I just find it so intriguing and fascinating. I love learning more about your journey and just some of the stuff you deal with on a day-to-day basis from a business perspective. Tell us more about the Chronicles of a CEO.
Sure. So that started actually when I started at Medical Health Associates. Our social media presence could use a little improvement. And we work with a wonderful marketing company. And one of the owners of the company said, Allison, you're the perfect person to start some sort of CEO Chronicles, some sort of messaging to get out there on social media. And he had suggested doing it on LinkedIn. And we had a very small LinkedIn following at the time. We didn't even have a MHA LinkedIn page.
Okay. So super important to have a company page for recruitment purposes.
Super important. So I had said, no one's going to want to hear from me. No one cares what I'm doing. And he said, do a couple of them. And I was like, so painstakingly, I did my first 2. And of course, I sent them to David. And I said, what do you think? And he was like, I think they're great. This is going to be great. And I was like, no one wants to see this. Well, I have been shocked at the amount of traffic that just these little, and you said you've read them. It's things that I encounter on a daily basis. It's the reps not taking me seriously because, I am a younger woman, or, being called sweetie or funny.
Young lady,
yep, all of those things. But then also just some of the differences in generational leadership from spreadsheets and people, where I think I had a CEO Chronicle of people over spreadsheets or something like that. And that, you need that interaction, you need that feedback. But then there's also the real things that happen. Last year, I went to a CEO summit at the MGMA National Conference, and I was super excited. And this was the CEO Chronicle, I think, that really made people start to follow MHA. Was I was in a room with probably 100 or 200 C-level executives, and I was super excited. And I sat down at a table, and they asked me to introduce myself. And being the only female at the table, I started out that, I'm a CEO. I have about 240 employees and 8 locations. Well, the next person who went said, I have 500 employees across 3 states and 27 locations. Someone else says, I've got 1,000 doctors at Duke. I've got, 800 at Nebraska. I've got... And all of a sudden I realized that I was a very small fish in this very big pond. And the CEO Chronicles really are about that. And there's we went on a trip and I completely disconnected from my email. And that was something that I had a lot of people reach out to me after that and say, how in the world did you not check email for 10 days? And it was my 20th wedding anniversary. And it was a big trip that we planned for, I feel like, 20 years. And I wanted to be present without email. And so it's really just the trials and tribulations of being a CEO and what we do and how we're still human. And that is, I think, something that I've realized on a different level since I've been in this position, is that at the end of the day, I am the same as every other person with a beating heart.
Yeah.
I am no different. I just have a title that people think means that I'm a superhero.
Certain way, yeah, there's a certain level, and you're still human.
Exactly.
And I think when you bring that human element back to it, like I'm a human, I go through the same things as every single person out there when it comes to navigating a career and job and balancing your personal life and your professional life. Like we all have different things that pull us in different directions, and how do you manage it? And I think that helps you relate more too with your team of employees as well.
And what we've actually found is when I do a CEO Chronicle, even if it's not tagged to our LinkedIn MHA company page, we get new followers, which is very interesting because it's not me posting directly on that page, but people then look at my profile and I'm, again, the same as everybody else. This is my job versus, your job as a recruiter.
Right.
So we all have different strengths, weaknesses, but we're all human.
And it comes down to human connection.
Yes.
Right? I think someone probably might see your post and they connect with it. They click on your profile, then they just say, they see medical health associates, and maybe it's a parent trying to find a new pediatrician for their child. And they're like, oh, that resonates with me. I like how they do things at medical health. Now I know more about medical health associates in West New York. Oh wait, there's one down an office down the street from me. I didn't know that. Let's check that out. Maybe we go there. And it just helps continue to build that connection and that rapport and build the business too.
And Western New York is so connection based.
Oh my gosh, it's wild. How do you find that compared to Boston too?
I find it refreshing.
Do you? Good.
Love it. I love how I can go to the grocery store and see people that I know.
Yeah.
And being here now for 16 years, there's a lot of people that I know, and
I'm sure,
it's tough because you can't leave the house, in your pajamas or without makeup, but that's okay.
And the day you do is the day you run into the most people.
Yes, exactly. That always happens. And I love that you said that about the LinkedIn connection. Maybe it's a parent that's looking for a new group or someone coming to the area. And those things, Western New York is about connections. And I think that we're pediatrics. Children are, not to sound cheesy, but children are the future. So it's important that we get our name out there and that people know who I am and who our doctors are and our locations. And I'm very proud to run this organization.
Yeah, it's such a warm and welcoming organization too. And just from knowing, I don't have children, so I can't speak to going to the practices, but even just getting to know you and your team and learning about medical health systems, you can tell it has such a nice, warm, welcoming presence where people don't feel like a number. Patients and families probably don't feel like a number going to the practices that they're at. They probably build that connection to the providers and the clinicians that they see on a regular basis. And then going in the office, which I'm sure can be really scary if their little baby, your child is sick and they don't know what to do.
Yep.
I'm sure first-time parents, there's probably a lot of them out there, and they're like, I don't know, they're sick and I don't know what it is. I don't know, what do I do? You want a practice and a clinician and a clinical team that understands you and connects with you and helps guide you through some of those stressful times as parents, I'm sure.
Yes, and we really strive for patient and parent satisfaction.
Yes, it's important.
Yes.
So those kids grow up someday, maybe they'll be a parent of a patient at Medical Health Associates.
Yes.
Or maybe they'll be part of the team here. Maybe they'll be
the
next CEO or the next pediatrician or nurse or billing manager here. Yeah, there's a lot of opportunities, but
yes, absolutely.
So much of it comes down to connection, and that's why I love doing and owning a business in Western New York. And I tell a lot of people, it's like you can make connections with so many people in this community that will help you in your career journey, your business journey, whatever it might be. Everyone wants to help or connect you with someone that can help you.
And that's what makes Western New York so special, I feel.
It really is. And I always love hearing that from someone who is not born in the community.
Yes.
But you probably have noticed, people probably like, well, where'd you go to high school?
Yes.
That's the connection. Where did you grow up? Southtown, Northtown, where'd you go to high school?
Yeah.
Do you know this person or that person? So you're like, well, no, I'm not from the area.
Yes.
But
I consider myself a Western New Yorker now, though.
Are you a Bills fan?
Yes.
There we go. Perfect.
Yep. Absolutely. How could you not be a Bills fan?
I was just going to say the exact same thing. How could you not be? Especially at this era that we're in right now. It's very extremely exciting. Although I did fall asleep for home opener this year. I didn't stay up.
We were at the game.
You were?
Yes.
Oh, fun.
And we didn't leave early.
I love it.
Ever
you are diehard.
Oh, yeah. Never
Bills fans now. True Buffalonians.
True Buffalonians.
I love that. Awesome. Well, Allison, we're so glad to have you in Buffalo, and it's been wonderful to hear about your journey as CEO of Medical Health Associates of Western New York. If people want to get in touch with you or with Health Associates of Western New York, how can they get in touch?
They can find me on LinkedIn. They can also go to the mhawny.com website and find me there. Perfect. So I'm definitely findable.
Awesome. Well, thank you so much again
Thank
for
you so
sharing
much
your
for
journey.
having me.
It's been great chatting with you.
Yes, thank you.
And
thank
we will
you.
make sure that you can follow Allison and Medical Health Associates. We will tag it in the captions, but make sure you take a listen to the Pain Point podcast, not only this episode, but future episodes. And we thank you for listening. Thanks for tuning in to today's episode of the Pain Points podcast. If you enjoyed what you heard, be sure to follow us so you never miss out on future episodes.